All right, let's get right into it. Welcome to today's Explainer. We're unpacking cardiovascular health, but honestly, we're not just going to sit here and read facts from a textbook. Actually, let's look at this as an origin story. The origin story of a disease that operates completely in the shadows, often for literally decades, before making a sudden dramatic entrance. We are unmasking atherosclerosis. We'll track it from the very first microscopic scratch inside your body, all the way to the massive clinical impacts it can have on your life.
Here's the roadmap for our journey today. We'll start by meeting your healthy arteries, understand what atherosclerosis actually is, break down the fixed and modifiable risks, zoom way in to see how these plaques form, and finally, look at what happens when things go wrong.
Section 1, meet your arteries. Because, before we meet our villain, we really need to set the stage and look at the incredible cardiovascular infrastructure inside all of us.
To appreciate how things break down, we've got to first see how they're built. Every artery in your body basically wears three coats, working from the inside out. First up is the tunica intima. That's your inner lining, made of a connective tissue matrix and smooth muscle cells. Next is the tunica media, which is the muscular middle layer packed with elastic tissue. And finally, you've got the tunica adventitia on the outside. That layer houses the nerve fibers and tiny nutrient vessels that actually feed the artery itself. This three-layered pipe is a total marvel of engineering. It is the healthy, normal baseline we all start out with. Moving into Section 2, understanding atherosclerosis. Let's introduce the absolute primary threats to this delicate plumbing system. Okay, let's clear up a super common medical mix-up. You hear these words thrown around a lot, kind of interchangeably, but they are absolutely not the same thing. On one hand, we have arteriosclerosis. This is a massive umbrella term that literally just means hardening of the arteries. It covers a general loss of elasticity and thickening. But atherosclerosis, that's a specific, highly destructive subtype of that hardening. It's defined by the formation of fibrofatty plaques, specifically in that innermost layer we just talked about, the intima. So the absolutely crucial point here is understanding the exact weapon of this disease. And that weapon is atheromas. These are patchy, fibrofatty plaques that deposit themselves right into the intima of your large and medium-sized arteries. Just imagine a buildup of grime inside a pipe. As these plaques grow, they physically push into the open space of the artery, what we call the vascular lumen, and physically choke off the pathway for your blood. Section 3, fixed and modifiable risks. Let's talk about the accomplices. Because, well, this disease doesn't just happen in a vacuum. We can split the risk factors into two camps. First, you've got your fixed risk factors. Basically, these are the cards you're dealt. Age is a huge one. The risk just naturally goes up as we get older. Being male is another. Men actually have a higher incidence of ischemic heart disease than premenopausal women, though women do catch up after menopause. And of course, family history. You can't change those. But look at the modifiable risks. Cigarette smoking, hypertension, diabetes. These are the daily habits and manageable conditions that absolutely dictate how fast this disease spreads. You hold the power here. Now, one of the heaviest hitters here is hyperlipidemia, which just means high lipids in your blood. This explains exactly why your doctor cares so much about your blood work. Total serum cholesterol under 200 is your desirable, safe zone. 200 to 239? That's borderline. But the second you cross that 240 mark, you are officially in the high-risk category for atherosclerosis. But total cholesterol isn't the whole story. We really need to look at LDL, or low-density lipoprotein. This is the bad stuff. It is absolutely loaded with cholesterol. Keeping it under 130 is the goal, but our source data really highlights that crossing a threshold of 160 milligrams per deciliter acts as a massive driver. It significantly cranks up both the risk and the severity of the disease. I mean, it's literally the raw material building those plaques we talked about. Conversely, take a look at this number, 35. This is tied to your HDL, or high-density lipoprotein. HDL is protective. Think of it as your molecular shield against the disease. But if your HDL drops below 35 milligrams per deciliter, you are highly exposed. And the data shows us that males, cigarette smokers, diabetics, and physically inactive folks frequently fall right into this dangerous low-shield territory. Beyond just the cholesterol numbers, there's a whole crew of other modifiable accomplices. We're talking central obesity, heavy alcoholism, which actually triggers hypertension, diets lacking antioxidants like vitamin C and E, and even things like anxiety and depression. But hey, here is the good news. Regular exercise for literally just 20 minutes, 2 to 3 times a week, actively protects you against coronary heart disease. It is a direct counterattack. Moving on to Section 4, how plaques actually form. We know the anatomy, we know the accomplices. Now let's look at the actual microscopic mechanics. So we really have to ask, how do these plaques actually form? How does a healthy, perfectly elastic artery turn into a hardened, clogged-up pipe? Well, it's essentially a microscopic heist, and it plays out chronologically. The most widely accepted theory in pathology is called the reaction to endothelial injury. It happens in 5 distinct steps. It all kicks off with an injury to the arterial wall, maybe from carbon monoxide in a cigarette or just high blood pressure pounding away. In step 1, monocytes and platelets rush in and attach right to that injured spot. Step 2, smooth muscle cells inside the artery start multiplying abnormally. Step 3, they synthesize a connective tissue matrix, basically laying down collagen. Step 4 is the big one. Lipids, like that nasty LDL cholesterol, get deposited straight into this matrix. And finally, step 5, the vault is locked. You've got yourself a fully formed atherosclerotic plaque. And if we actually slice that plaque open, what does it look like? Well, to the naked eye, it's this yellow-white bump, but microscopically, it's got 3 distinct layers. At the top, there's a fibrous cap made of dense collagen. Right in the middle is the lipid zone, which is just completely packed with lipids and these things called foam cells. Foam cells are essentially macrophages that have literally gorged themselves on fat. And at the bottom, you have the basal zone, which is connective tissue anchoring the whole thing to the artery wall. Which brings us to our final act, section 5, when things go wrong.
Look, just having these plaques is bad enough, but the true danger lies in their complications, and it gets pretty intense. Thrombosis is the most common issue. That's when a blood clot forms right on the plaque, which can completely occlude or block the artery. You could also see dystrophic calcification, literally turning the vessel into a rigid calcified tube. Or the plaque could ulcerate, tearing open and shooting chunks of cholesterol down your bloodstream. A plaque could hemorrhage and suddenly swell up, or weaken the artery wall so much it triggers an aneurysm. These are severe, cascading, life-threatening outcomes. But here is probably the most chilling fact from our source material today. Look at this threshold, 70%. Atherosclerosis is an absolute master of stealth. A decrease in blood flow usually only produces clinical effects, like the severe chest pain of angina or a full-blown myocardial infarction, a heart attack, when the artery is narrowed by more than 70%. By the time you actually feel the villain's presence, it has already claimed nearly 3/4 of your vital infrastructure.
We've seen how the plumbing works, how the plaques invade, and the totally devastating complications they cause. Your arteries have a memory, you know. They record the impacts of age, smoking, diet, and exercise over decades. Now, you can't change your fixed risks, but you absolutely hold all the cards when it comes to the modifiable ones. So based on the evidence we explored in this explainer today, which modifiable risk factor are you going to choose to change today? Thanks for joining me. Keep learning, stay curious, and please take care of your arteries.